Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating piece of veterinary research, looking at how a common chemotherapy drug, vincristine, affects dogs of different sizes when they're being treated for lymphoma.
That's right, Emma. This study, published in the Journal of Veterinary Internal Medicine in 2024, caught our attention because it tackles a really important question in veterinary oncology. Are smaller dogs more susceptible to side effects from chemotherapy drugs that are dosed based on their body surface area?
Exactly. The traditional way of calculating chemotherapy doses is based on body surface area, or BSA for short, with the idea that this gives a better estimate of how the drug will be distributed, metabolized, and eliminated compared to just using body weight. However, the researchers point out that the formulas we use to figure out BSA in dogs come from studies with a small number of dogs and a limited range of weights.
And there's a suspicion that smaller dogs might have a faster metabolism compared to larger dogs. This could mean that body surface area alone might not fully account for how these drugs work in their systems. Some previous studies have even suggested that smaller dogs are at a higher risk of experiencing problems like reduced white blood cell counts, which we call myelosuppression, and gastrointestinal issues when they receive chemotherapy drugs like doxorubicin, carboplatin, and others based on their body surface area.
This is where vincristine comes in. It's a chemotherapy drug that's frequently used to treat various cancers in dogs, especially cancers that originate in the blood cells, like lymphoma. It works by interfering with cell division, ultimately causing the death of rapidly dividing cancer cells. While it's generally considered less likely to cause myelosuppression compared to other chemotherapy drugs, dose reductions due to low white blood cell counts aren't uncommon in dogs receiving it.
And this particular study aimed to investigate whether smaller dogs, specifically those weighing 15 kilograms or less, experienced a higher frequency of hematologic, meaning blood-related and gastrointestinal side effects compared to dogs weighing more than 15 kilograms when treated with vincristine for newly diagnosed lymphoma. The researchers hypothesized that the smaller dogs would indeed have more of these adverse events.
So, to answer this, the researchers conducted a retrospective study, which means they looked back at the medical records of dogs that had been treated with vincristine for lymphoma at 2 different veterinary hospitals. They included 138 dogs in their analysis. 38 of these dogs weighed 15 kilograms or less, and 100 dogs weighed more than 15 kilograms. They looked at blood count data taken before and after the vincristine treatment, as well as other information from the dog's medical records.
Let's move on to what they actually found, Emma. What were the key results of this study?
Well, when they looked at the occurrence of neutropenia, which is a decrease in a specific type of white blood cell called neutrophils and a key indicator of myelosuppression, they found that it happened in 17 instances overall, which is about 12.3% of the dogs. Interestingly, there was no significant difference in how often neutropenia occurred or how severe it was between the smaller and larger dogs. 5 of the smaller dogs experienced neutropenia, while 12 of the larger dogs did. That's quite interesting, considering the initial hypothesis. What about more severe cases of neutropenia?
Even when they looked specifically at grade 3 or 4 neutropenia, which are more serious levels, the researchers found no significant difference between the two weight groups. 4 of the smaller dogs had grade 3 neutropenia, and 4 of the larger dogs had either grade 3 or 4. And the vincristine dose itself? Was there a difference in the dose administered to the two groups?
The median vincristine dose was the same for both groups, 0.6 milligrams per square meter of body surface area. They even looked at the subgroup of dogs that received this exact dose, and still found no significant difference in the frequency of neutropenia between the smaller and larger dogs.
So, it seems like for hematologic side effects, at least in terms of neutropenia, body weight didn't play a significant role at these dose levels. What about gastrointestinal side effects?
This is where things got a bit more complicated. They focused their analysis of gastrointestinal adverse events on the dogs that were considered to be in substage A of lymphoma at the time of diagnosis, meaning they didn't have systemic signs of the disease. Among these dogs, 30 of them, or about 29.4%, experienced gastrointestinal issues. The most common of these were diarrhea, followed by vomiting, and then decreased appetite.
But the study mentioned some challenges in comparing these side effects between the weight groups, right?
Yes, that's a crucial point. A large number of dogs in both weight groups, including some that didn't even show any gastrointestinal signs, received medications to help with potential gastrointestinal issues. Because this supportive care was so widespread, and because the study was retrospective, the researchers couldn't definitively say whether these medications were given preventatively or to treat actual symptoms. This made it impossible to statistically compare the frequency of gastrointestinal adverse events between the smaller and larger dogs.
That's a significant limitation. What about hospitalization rates? Did smaller dogs end up in the hospital more often due to side effects?
They looked at that as well. 7 dogs overall, or 5% of the total, required hospitalization because of adverse events. 3 of these were smaller dogs and 4 were larger dogs. Again, there was no statistically significant difference in the risk of hospitalization between the two groups.
So, to summarize the key findings, it appears that smaller dogs treated with vincristine at doses of 0.6 milligrams per square meter or less for lymphoma did not have a higher risk of neutropenia or hospitalization compared to larger dogs. However, the impact on gastrointestinal side effects couldn't be clearly determined due to the extensive use of supportive medications.
Exactly, David. This leads us to the discussion section of the paper, where the researchers interpret their findings and talk about the implications.
What were their main takeaways from these results?
The researchers concluded that, contrary to some previous concerns, smaller dogs don't seem to be at an increased risk of neutropenia after being treated with vincristine when dosed based on body surface area at or below 0.6 milligrams per square meter. While a slightly higher percentage of smaller dogs did experience more severe neutropenia, this difference wasn't statistically significant. They also didn't find smaller dogs were more likely to be hospitalized due to side effects.
They also touched on the practice of dosing chemotherapy based on body surface area, didn't they?
Yes, they revisited the assumption that body surface area is always a better predictor of drug handling in the body than simple body weight. They pointed out that even though smaller dogs receive a higher dose of vincristine per kilogram of body weight when dosed by body surface area, the frequency of blood-related side effects was similar. This suggests that other factors, not necessarily related to size, like breed, age, the stage of the cancer, and any other health issues the dog might have, could be more important in determining how they react to the drug. They even mentioned that perhaps at higher doses of vincristine, a difference in side effects based on weight might become apparent.
The paper also put their findings into the context of previous research on vincristine and other chemotherapy drugs.
That's right. They noted that while some studies have reported higher rates of neutropenia with vincristine, the overall rate in their study was relatively low. They attributed this potentially to the fact that the dogs in their study were receiving vincristine for the first time and weren't on other potentially myelosuppressive drugs like L-asparaginase at the same time. They also highlighted that their study looked at the effects of a single dose, whereas many other studies track side effects over an entire chemotherapy protocol.
And they compared their findings to a study done in Japan, if I remember correctly.
Yes, they did. They found that the frequencies of hematologic and gastrointestinal side effects in their group of small dogs were actually quite similar to those reported in that previous study, even though the geographic locations were different. This is interesting because in human medicine, there's evidence of geographic variations in how people tolerate chemotherapy. The researchers noted that more studies are needed in veterinary medicine to explore whether geography plays a role in chemotherapy side effects in animals.
The limitations of the study were also discussed, which is always important in research.
Absolutely. They emphasized that the retrospective nature of the study meant there was variability in how side effects were reported in the medical records, especially for gastrointestinal issues. The widespread use of gastrointestinal support medications, sometimes even without documented signs, was a major challenge in accurately assessing the true frequency of these side effects and comparing the weight groups. They also mentioned that the timing of the follow-up blood counts wasn't completely standardized, which could have potentially missed the lowest point in a dog's neutrophil count.
And the concurrent use of prednisone, a common steroid used in lymphoma treatment, was also a factor they considered.
Yes. They acknowledged that prednisone itself can sometimes cause gastrointestinal issues or affect white blood cell counts, so it's possible that this could have influenced their results. Finally, they pointed out that the median starting dose of vincristine used in their study, 0.6 milligrams per square meter, was slightly lower than what's used in some other chemotherapy protocols, which often start at 0.7 milligrams per square meter. This means the side effects they observed might have been less frequent or severe than what could happen with a higher dose.
So, what do the researchers suggest for future research based on their findings?
They suggest that a prospective study, meaning one that looks forward and collects data in a standardized way, would be valuable. This type of study could evaluate the side effects of starting with a higher dose of vincristine in dogs with newly diagnosed lymphoma and, importantly, avoid the routine use of prophylactic gastrointestinal medications so that the true frequency of these side effects can be better understood and compared between different weight groups.
This study provides valuable information for veterinarians treating dogs with lymphoma using vincristine. It suggests that for smaller dogs, at least at the doses studied, concerns about increased neutropenia might not be as significant as previously thought.
Indeed. However, the challenges in assessing gastrointestinal side effects highlight the need for more careful monitoring and documentation in clinical practice and future research. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.